Hello, this is Dr. David Greene, CEO of the Arizona Pain Network. Today's topic is what you need to know about occipital nerve blocks. Well, what is an occipital nerve block? It's an injection of numbing medicine next to the occipital nerves. They are located on either side of the scalp. You can see here the greater occipital nerves on the right and left side. And there's also some lesser occipital nerves which really aren't shown very well here. And either one can produce pain. Now, these are not motor nerves. They don't, help your arm move or your head move. All they do is provide sensation to the scalp. The injection is designed to stop the pain traveling along these nerves, which can lead to either what's called occipital neuralgia, cervicogenic headaches, or migraines. And there's two purposes for doing these injections, both a diagnostic and a therapeutic one. Well, what are the symptoms of occipital neuralgia? Typically it's pain either in one or both sides of the head, a tenderness over the scalp area, aching, burning, throbbing pain. It also may be described as a sharp or an electrical shock in the back part of the neck and head. Who benefits from these blocks? Well, as mentioned, occipital neuralgia patients, those suffering from migraines can get excellent benefit. Cervicogenic headaches, this is really any headache caused from the neck. All right, it's typically one-sided. And then those who have cluster headaches, these are one of the most painful types of headaches and do very well with occipital nerve blocks. How's the procedure performed? It's a quick injection. It can be done in an outpatient setting in the office. There's no need for sedation. The pain doctor feels the point of maximal tenderness at the base of the skull, and then the doctor injects numbing medicine and maybe some steroid around the areas of these nerves. Okay, and it typically moves the needle around to get an area of broader coverage. How well does the procedure work? For a procedure that's really quick and low risk, it does amazingly well. The numbing medicine typically kicks in within minutes. And for cervicogenic headaches, studies show that anywhere from a 50 to 90% response rate, averaging close to 3 months almost, which is amazing. Cluster headaches, even a higher response rate of 85%, and pain relief is anywhere from 4 weeks to 4 months. And for those who have occipital neuralgia, once again, 85% response rate, a little lower time frame, 1 to 2 months. And then for migraines, patients get a 60% response rate, which averages 4 to 5 weeks. These injections can easily be repeated. And if the pain relief does wear off, like I mentioned, you can repeat these procedures. You can also end up getting a radio frequency ablation. And what that does is that it puts a catheter into the back of the neck and it heats up these occipital nerves and it can deaden them for anywhere from 6 to 18 months. Okay, and then studies show that if you go ahead and repeat that, then it can work just as well. And there's no large studies that show this statistically, but there's some small studies that show it works well. You have to remember, this is not a high-risk area, right? I mean, you're right next to the scalp. You're not around the spinal cord at all. You're not even going into the epidural space. You're simply going subcutaneously around the area of the greater and lesser occipital nerves. It's not a motor nerve either, so there's no risk of causing, dysfunction with that. It's just a sensory nerve, and you're basically deadening it, and it can work well for multiple conditions. Are there risks? Minimal. It's a vascular area, so you might get some slight bleeding. You might need a little pressure. The needle's outside the spinal canal. These are not motor nerves. There's no risk of a cerebrospinal fluid leak or any spinal cord injury. At Arizona Pain Specialists, the most comprehensive pain management in the Valley is offered. It really is a one-stop shop. You have medical and interventional pain management options, chiropractic, acupuncture, spinal decompression therapy, along with physical therapy. There's 6 locations taking over 50 insurances. The doctors are board certified. They've won the Patient's Choice Award 5 years in a row. Amazing. The number to call for scheduling is 602-507-6550, and the website is preferredpaincenter.com. There's a huge online library of educational material, lots of videos. Come visit us today. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.